Hi, welcome to the Addiction Recovery Place, the podcast champion addiction treatment specialists around the world. I'm your host, Chris Langley, and today I'm pleased to introduce today's guest, Laura Goode, who's the CEO and co-founder of Ignite Recovery, which is located in Riverfall, Massachusetts. Welcome to the Addiction Recovery Place podcast, Laura. Thanks for joining us.
Thank you, Chris. Hi. Thanks for having me.
I
It's
really
actually Fall River, but, we won't hold you to it. You're British.
I thought I said that. I'm very sorry. Very sorry about it. Fall River, Massachusetts. Sorry. Before we start today's podcast, Laura, I'd just like to read this paragraph, which I took from your website, which I think everyone should hear. Ignite Recovery's goal is to wholly support individuals in their journey to find their pathway of recovery. Our approach is meeting individuals exactly where they are at, no matter what stage of change they're at on their recovery. That's a really nice piece. I just wanted to read that. Laura, please tell us about yourself and your role at Ignite Recovery.
So, myself and my role at Ignite Recovery. So, Ignite Recovery was kind of born in the pandemic. Myself and a friend of mine decided to, kind of step out on our own, and, create an organization that, that treated people the way that we thought people should be treated and gave opportunities to employees that, that were good and fulfilling. And, to be frank, we just thought we could do it better than our boss. And turns out we were right.
What were you doing before you started this, Laura?
So I have worked kind of in a variety of administrative settings. Prior to this, I was a program director for a recovery community organization that was operated with a grant through SAMHSA. So it was more like a drop-in recovery center. And then prior to that, I used to work at a toxicology lab for about 5 years. So I've kind of done a little bit of everything. And, I like to kind of jump in and ask good questions and, get things done.
Absolutely. It certainly sounds that if you've started this service yourself, I mean, that's quite incredible. So no, big congratulations on that. So what services and programs do you provide your community?
So we focus on recovery support services. So mainly recovery coaching, which I know isn't a thing necessarily everywhere. But recovery coaching, which is, a service that we provide to individuals. Our coaches all have lived experience. They're all in recovery themselves. And, we support people. They identify their goals, and we try to connect them to the resources within the community that they identify that they need. And then we also offer recovery support navigator services, which is a little bit more of a case management role. And they kind of help individuals get through the barriers that people have when they're trying to achieve recovery or attain recovery and maintain recovery. Things like basic needs, like homelessness, food insecurity, legal issues. We bring people to court and kind of clear up warrants and things like that. So all the things that, are really sometimes the biggest stressors when you're getting into recovery, we try to kind of help them walk through that so they don't have to do it alone.
Mm-hmm. So you help people in the court process as well?
Yes. I mean, we're not lawyers, but
No.
we'll show up with you and, cheer you on and,
mm-hmm.
Make sure you get to your court dates. And especially when people are getting into treatment, sometimes they're kind of all, they may be from a different area and they land in treatment in a different part of the state because, the treatment centers aren't everywhere. They're not in every city, in every corner, unfortunately. So sometimes they'll have some pending legal issues in a whole different part of the state. So to try to navigate, public transportation to get to a court date for 8:30 or 9 o'clock, 60 miles away, is can be, intimidating. So, yeah, so that's some of the things that we do. And then we also offer, an outpatient substance use counseling. So, via telehealth and in office, with licensed, master's level clinicians. And then we're also going to be offering day treatment, in the near future, which is like a extended, clinical outpatient, 3 to 5 days a week. So for people that, are getting out of treatment, can't quite stay inpatient still, but still need like the support and, need to fill their days up so that they make the right decisions.
Absolutely. So how's your service funded?
So we live in the great state of Massachusetts, which is, our Medicaid, program pays for these services through insurance. So we bill insurance. And luckily our state government plans pay for these services, because I know that there's not every state that will reimburse for these services. So I feel like we're really kind of ahead of the game, and it's really proven to, it's not like when I got clean 11 years ago. They didn't have all these services. So I feel like we are definitely making positive changes in the right direction.
Absolutely. I mean, it sounds like you're doing a very wide range of services. It's, you're helping people with their lives, and you're also helping people with their addictions, which is the whole package basically.
I
So
mean,
yeah, that's pretty amazing stuff. So thank you for that. So tell us about your team. I mean, how many people have you working at your service?
right now we have 8 people. We have 2 clinicians. My office manager, who is like my brain, she keeps us, she's the glue that kind of holds us together. And 5, right? Yeah, and 5 coaches and RSNs. Some people are a coach and an RSN. Some are just recovery coaches, but we have 5 people that are out in the field, doing the work kind of every day.
Wow. So it sounds like you've got a pretty tight team there. So
We
excellent
do.
stuff.
It's we have a great team.
Mhm.
Excuse me. And everyone that, that's here is, we really try to work together. And it's, sometimes it takes a lot of effort to keep the communication going, and to be sharing resources and staying on the same page. But I'm really grateful for the team that really helps us put this all together, because, without them, I mean, I can sit here and push papers all day long, but it's not going to, do the community any good without them. So.
Mhm. Excellent stuff. So Laura, what are the common addictions that you help over at your service? What are the things you see most?
I mean, fentanyl. It's not really heroin anymore. It's fentanyl, and that seems to be present in, not just what people think, they're purchasing, like heroin or fentanyl. It's often present in the coke and the crack that people are getting too. People that never thought that they had any interest in an opiate are, going into treatment and finding out that they, test positive for fentanyl. So, a lot of that. And then, we're starting to see more crystal meth in this area, slowly than we ever had before. It seemed like that was an over that side of the country issue for a long time. And now it's becoming, our own issue as well. So
you've seen that change over the last few years, have you, around crystal meth?
yes, yeah, there's been a lot more people that seem to, have been using that a little bit. So I'm sure it can get worse, knock on wood, but but that seems to be and then we also have a lot of people that drink, a lot of people that drink alcohol. That's, kind of a low key, I feel like people sleep on the insidiousness of, that substance, that can really, really tear people's lives up and kill them, really. Um, so that seems to be the, the most of, but we really try to focus on not what people are, using when they come to us. I mean, we identify, if they want to stop or how they want to stop and what that looks like for them. And really kind of replacing the bad stuff with the good things in life, and really like, trying to identify people's, what we call recovery capital. So, everyone in their life, when they're entering recovery kind of has a different, set of strengths and weaknesses. And, we try to identify the things that, people want to live for, really. Some people have, great families that they're tired of, disappointing. And some people have, a career that they don't want to throw away entirely. So that's really what we try to focus on, once we get the drugs kind of out of the way.
Mm-hmm. So you're able to test for fentanyl?
We actually don't test. We don't do any drug testing here.
Mm-hmm.
It's not really, we rely on our clients' own reports and, what they tell us. So, I mean, sometimes, it'll be like, oh, I need to get a job, and I need, to get a psychiatrist, and I need all these things. And it seems as though it may be like a problem using drugs. But we kind of just work with people and take kind of what they identify as their problems and try to get to the other side. So we don't do any, drug testing. We're not like punitive in any way if you relapse, or, we have kind of a high threshold for the people that we'll work with. We don't, or low threshold rather. We don't, if you're continuing to use and you go to detox, 100 times in a year, we'll take you the 101st time, as long as you don't put, you're not threatening and, don't put us in any danger. We're here to keep trying with people. So, and that really, really does, like, as people go through different treatment facilities and travel around the state in their journey to try to find recovery, we're able to stay with them and build that rapport so that, when, the stuff hits the fan, we're able to answer the phone and try to, we're kind of like that lifeline, like that one call, so
you're a constant support for your clients. For the
yes.
I love that. I absolutely love that. Thank you for explaining that to me, Laura. I just wanted to ask, since your state became a legal marijuana state, have you seen any uptake in people accessing your service for this? Has it affected drug services at all?
I mean, I guess the one piece that seems to present itself is sometimes people decide that they are able to, just kind of, smoke marijuana, and that's, their pathway. But, I have seen, and we have seen that sometimes it doesn't work, just like any pathway, right?
Yep.
And also we've kind of run into providers where, some of because we connect people to different nurse practitioners and PCPs and things within the community. And sometimes if a client is looking for just like a card, a provider won't necessarily be one that is willing to give one because it's not legal federally. So I've seen that a few times. So, we just try to navigate that the best that we can.
Excellent. Good stuff. So how do people come to access your services, and where do you receive most of your referrals from?
I would say we get a lot of our referrals from other clients that talk about the services that they receive from Ignite Recovery
Mhm.
to the people that they're around. A lot of times, when people are in treatment, they'll be talking about, the problems, the common problems that they face. And, they may say, oh, well, my coach at Ignite Recovery helped me do this, this, and this. So we do get a lot of referrals that way. And then we really try to build and maintain good relationships with other providers within the community. I'm really big on, a recovery oriented system of care. And we're just one small piece in an entire system that supports the individuals that we serve to achieve and maintain recovery. So, detoxes and, um, you know, um, methadone treatment centers and, different types of even other agencies that offer coaching and similar services. I really try to maintain good relationships with those other organizations because I mean this isn't something that one agency is going to be able to solve on their own. And I think that sometimes it seems as though our different places can lose sight of that. And I really want to try to we're not always the best fit for everyone, but sometimes, we are exactly the right fit. And, people in the community know who to call.
Yeah, yeah. So it's all about networking with other agencies
Yes.
and joint working. I love that. I think that's fantastic. Um, I noticed on your website, Laurie, that you have a recovery coach program. Can you explain in some detail about this, how it works, and how successfully it assists people within their own recovery?
So I mean it, works is, pretty much that's kind of the first service that we'll start with an individual. I talked about having like a low threshold and that's, really um it gives us a good range of we're able to engage with people as little or as much as they want. And sometimes people, don't really want to be pushed per se. But sometimes people do just want to know that there's somebody out there that does care if they're using or does care, when they, get their kids back and, kind of all those milestones. So as I said, there's training requirements that are needed for, within the state. So everyone goes through those trainings. It's a 5-day recovery coach academy, as well as an ethical considerations training for recovery coaches. And everyone that we hire here has done those and is working on the remainder of the required trainings in order to get their certification. Um, and then, for as far as the coaches, we do a lot of supervisions. So, because so much work is done within the community and, um, we really try to keep ourselves connected as a team so that, um, you know, so that nobody feels like they're kind of out there doing the work, without the support. I don't
Mhm.
want anyone to, um, we all represent a team, myself included. So, we don't need to be out there doing, renegade stuff on behalf of Ignite Recovery. Because it is hard work and it's taxing. And, even myself, like sometimes I'll find myself, with people that we work with or have been working with for a long time, I may find myself wanting to do something a little bit different or a little bit more for them. Which is why I need to stay connected to, my team and my clinical director to really kind of support each other within, the effort that we're putting out there for our clients.
Wonderful, wonderful stuff. And last couple of questions, Laura. Through these podcasts, I've discovered many different opinions around harm reduction. Can you tell us your ideal explanation of harm reduction and what what you think this is?
So, I mean, I've been in and around recovery for a long time myself. And, I have kind of a personal pathway that, has, become true to me in my life. It's very different than what I believe when I get to the office. As a whole, right? Like, so many people are dying that at this point, I really feel like harm reduction is just keeping people alive. In different, and so really all of the treatment and recovery efforts is harm reduction, right? I mean, that,
Absolutely.
I'm not clinical. I don't have any letters behind my name. All of my experiences, hard won. And, so you don't, not a
Wonderful.
scientific, whatever, but really, I just think that, like I said, the recovery oriented system of care, right? Like,
Yep.
It takes, um, it takes all the Narcan in the community to keep people alive. It takes you know, the, like the harm reduction kits, the bleach and syringes. And, it takes all that stuff to keep somebody alive long enough to be, the mom that they can be, and the person that they can be, and the person in the community that they can be, myself included. I mean, it's, I,
Yeah.
put some miles on myself, out there. And so, and if it weren't for those those services that kept me, alive and safe, and, the wet shelters, and the, outreach efforts, and the, whatever else, Ignite Recovery wouldn't exist. So I just try to never count anyone out, and, you know, just hope and pray that, that people get to achieve recovery for at least one day, whatever that looks like for them.
Yeah. One day at a time, and keeping your clients alive. That's pretty much, yeah, I love it. Absolutely love it. Thank you for that, Laura. Um, have you any future plans for Ignite Recovery at all? What's going to happen in the future for you guys?
I
What are you
mean,
looking at doing?
so like I had mentioned, we did just get day treatment added to our license. So in the near future, we plan to be offering those services, as kind of another kind of caveat of the things that we offer. I think we'll probably always be, focused on, the peer supports that we've really, um, built, this company on, really, those principles. Like I said, we have a lot of really great relationships with different organizations, and treatment centers, and, people within different communities throughout the state. So I'm sure we will add locations. At this point, it's kind of up in the air, but I'm going to kind of allow the need to present itself, before we commit to expanding to any one particular
Of course.
area. And also, it really, um, so much of what we do and what we can offer depends on the staff that we have available. And so, um, really, I'm just trying to focus on pouring into our staff, and giving them all the support that they need to do the best job that they can. And then, the rest is kind of, up to God, and whichever direction we go, we'll show up and do the best we can.
Yeah. Wonderful, wonderful stuff. Where could people find you, Laura? Online or
So we have a Facebook, Ignite Recovery. Our website is igniteMyRecovery.com. Kind of catchy.
great.
People can submit referrals. That electronically secure right on the website. And we're here on Bedford Street in Fall River, 672 Bedford Street. But we're around. So
Excellent. Excellent. Thank you for that. Is there anything I've forgotten to mention, or is there anything you'd like to add for our audience today, Laura?
I mean, I don't, not that I can think of. So I'll probably think of something as soon as we end it.
Okay.
But
Okay. Well, on that note, Laura, thank you very much for your time. I know you're incredibly busy, and I really appreciated you coming on to talk to me today. And we look forward to hearing about your future journey later on. But thank you very much indeed. Much appreciated.
thank you so much, Chris.
You take care. Cheers.